Today, we would like to talk about signs the body gives before a heart attack. About 200 million people in this world are living with coronary heart disease. And in the United States, every 40 seconds, someone has a heart attack. When the blood supply to the heart is significantly obstructed or stopped, a heart attack happens. The accumulation of fat, cholesterol and other materials in the coronary arteries is typically what causes the obstruction. These build-ups, known as plaques, form a mass that disrupt blood flow and damage a portion of the heart muscle. You can simply prevent yourself from this horrific fate if you can spot it early. However, not all cardiac conditions have obvious symptoms. As you see in movies, there isn't always a startling chest clutch followed by a tumbling to the ground. In this video, I'm going to walk you through 7 signs your body gives before a heart attack. Stay with me throughout as I'm going to cover 3 uncommon yet unmistakable signs in the end. Let's get right into it. It can mean the difference between life and death to recognise the warning symptoms of a heart attack and seek immediate assistance. Here are the top 7 symptoms to watch out for, followed by 3 unusual signs. Number 1. Unease in the chest. It is the most common sign that your heart may be having problems. When you are having a heart attack, or if you have a blocked artery, it is possible for your chest to hurt, feel tight, or feel as though it's being pushed on. This pain may manifest itself as long-lasting pulses that last for several hours at a time. Both when you are still and when you are moving around, this could happen. That sensation is given a different description by each person. Some people report having the feeling that an elephant is sitting on top of them. Some people report that it causes a burning or pinching sensation. If the discomfort only lasts for a brief period of time, or if you can make it worse by touching it or pressing on it, the source of the pain is probably not your heart. Despite this, you really ought to get it checked out by a professional. You should seek medical attention if the symptoms get worse or if it doesn't go away after a few minutes of monitoring. Also, keep in mind that it is possible to have an issue with your heart or even suffer a heart attack even if you do not feel any pain in the chest. This is something that typically affects women more than it does males. Number 2. Aching in multiple areas of the body. Pain from a heart attack can occur in other parts of the body in addition to the chest, including the back, shoulders, limbs, neck and jaw. According to studies, if there is a problem in the heart, such as a blocked artery, the nerves in your heart will send a message to your brain that something is wrong, and you will experience discomfort as a result. Due to the fact that the vagus nerve is connected to the heart, the brain, the chest, the abdomen and the neck, it is possible for you to experience those pain signals in locations other than the heart. The pain that extends to the arm is one telltale symptom. A typical heart attack sign is pain that travels down the left side of the body. It almost always radiates outward from the rib cage. Another typical sign is a pain in the jaw or throat. Jaw or throat discomfort on its own is probably not a sign of a heart problem. It's more likely to be brought on by a muscular problem, a cold or a nasal issue. However, it may indicate a heart attack if you experience discomfort or pressure in the middle of your chest that radiates up into your throat or jaw. Number 3. Having dizzy spells. Dehydration, skipping meals and standing up too rapidly are just some of the things that can contribute to dizziness. Other causes include not getting enough oxygen in your body. On the other hand, experiencing fainting or dizziness in conjunction with chest discomfort and shortness of breath can be an indication of a decrease in blood volume and blood pressure, both of which point to the possibility of an impending heart attack. Number 4. Burnouts. After a night of poor sleep or a difficult day, it is natural to feel exhausted the next day. However, if something that you've always been able to do, like carrying groceries from the vehicle or climbing the stairs, causes you to feel exhausted or out of breath, you should make an appointment with your primary care physician as soon as possible. Women are more likely to exhibit this sign than males. According to medical experts, women may experience feelings of exhaustion up to 1 month before having a heart attack. Number 5. Nausea or indigestion. According to those who specialise in heart disease, gastrointestinal symptoms such as nausea, vomiting or belching manifest themselves when the heart and other areas of the body do not receive adequate blood flow. It is essential that you make an appointment with your doctor, particularly if you are experiencing other symptoms of a heart attack, as it is possible that it will be mistaken as acid reflux or indigestion. It's possible that some people will experience symptoms similar to heartburn, even to the point of making them vomit. Women are more likely to report experiencing this kind of sensation in comparison to men. There are, without a doubt, a wide variety of additional reasons for abdominal aches and pains that have nothing to do with your heart. After all, it's possible that it was just something you consumed. However, you should continue with extreme caution if you also experience any of the other signs that are included on this list. Number 6. Perspiration. Breaking out in a cold sweat or perspiring excessively could be a sign of a heart attack, unless you're going through menopause or have just exercised. During a heart attack, your nervous system may cause you to experience a fight or flight response, which places you in a state of preparation for survival and may cause you to begin perspiring. In the event that this happens in combination with any of these other symptoms, seek medical attention as soon as possible. Do not even try to drive yourself. Number 7. Heart palpitations. When you are anxious or excited, your pulse may race, or it may occasionally skip or add a beat. However, if it persists for a prolonged period of time, or if it occurs frequently, let your doctor know. Most often, it's something simple to solve, like too much caffeine or insufficient sleep is the root of the problem. However, on occasion, it might be an indication of heart problems. There are many different things that can go wrong in the body when your heart is not receiving enough circulation. According to medical professionals, a shortage of nutrient-rich blood can cause the heart to become agitated and cause heart palpitations. So we just saw the 7 warning signs your body typically exhibits before a heart attack. And now, as promised, let's take a look at 3 unusual indicators. Number 1. Snoring. You're allowed to wheeze a little bit while you sleep. However, snoring that is particularly loud and sounds like gasping or choking may indicate sleep apnea. You may experience this several times throughout the course of the night while you are still asleep. Your heart is under additional strain as a result, which causes cardiac problems. Although this is more of a cause than a symptom, it is indeed a cause of concern. Number 2. Chronic cough. Coughing is a common problem that can be traced to a wide range of different factors. If you have a continuous cough that produces white or pink mucus, this could be an indication that you are suffering from heart failure. In the event that the heart is unable to keep up with the demands of the body, blood may leak back into the airways. Make an appointment with your healthcare provider so he can investigate the cause of your congestion. Number 3. You have swollen feet, ankles and legs. This might indicate that your heart isn't pumping blood as efficiently as it ought to. Blood builds up in the veins and produces bloating when the heart cannot pump blood quickly enough. Bloating may result from heart failure because it may be more difficult for the kidneys to eliminate excess water and sodium from the body. With this, we wrap up this episode. Remember, if you've had a heart attack, you may also be at risk for another heart attack, or conditions such as a stroke, kidney disorder, and peripheral arterial disease. Have you or someone else you know experienced any of these signs? Let me know in the comments below. If you like the video, do hit the like and subscribe button. Thanks for watching. See you in my next video.